High cholesterol is common amongst people of every nation. Almost 95 million Americans have high cholesterol, and a large percentage of them are people over 50. This fact alone makes your cholesterol levels one of the most important things to watch out for. You may have heard of cholesterol on occasion and how it is good for the body. And although that may not be wrong, as the saying goes, too much of everything is bad. And in this case, too much cholesterol in your body can be catastrophic for your health. If you watch this video, you're taking the proper steps to making healthier decisions, and your body will thank you for it. Although the presence of high cholesterol in the body has no symptoms, there are signs to notice that may give you an idea. Here are the 8 early signs of high cholesterol. Cholesterol appears in the body primarily through the liver, and the liver makes all the cholesterol that your body needs. Additional cholesterol comes from the foods and meat we eat, and if not properly moderated, these unchecked levels of cholesterol in the body can cause serious health risks. When the cholesterol reaches unhealthy levels, there are a few signs to check out that you may notice. Number 8. Tingling in the body. This is the first sign of high cholesterol that people over 50 usually notice. Tingling sensations in and around the body can be one of the symptoms of high cholesterol levels. Tingling sensations in the parts of the body, commonly referred to as pins and needles, can occur without any underlying health issues. Instances like putting on a tight shoe or dress or laying on a part of the body for extended periods can cause this. If you notice recurring tinglings without any of the instances mentioned above, it is probably due to difficulty in blood flow, which is usually caused by high cholesterol. The high cholesterol levels in the blood make the flow thick, causing interruptions in the blood flow to certain parts, affecting the normal flow of blood in the nerves and sending a tingling sensation around the body. These sensations can be uncomfortable and painful. Number 7. Arcus Senilis. You may notice a gray or white arc around the cornea. The cornea is the transparent part of the eye that covers the iris and the pupils and allows light to enter. Arcus Senilis, also known as corneal arcus, is the medical term for this condition. This occurs when fatty substances, or lipids, accumulate in the eye and take on ring-like forms. This arc, formed by the condition, may form a complete ring around your iris, which is the colored part of the eye. This is prevalent in young adults, but can also be found in older adults with dangerous amounts of cholesterol in their bodies. There isn't much to worry about, as this condition doesn't affect your sight nor require treatment, but it is a sign that you may need to keep your cholesterol levels in check as you age. Number 6. Swelling in the legs, ankles, and feet. Too much cholesterol has been linked to inflammation in the legs. This kind of swelling is called peripheral edema, which means that your lower legs or hands are getting bigger. The condition is commonly associated with vascular and cardiac changes associated with aging, but can be caused by many other conditions, including high cholesterol. While it may be a sign of high cholesterol in the body, it can also indicate dysfunction in the lymph nodes, kidneys, liver, or heart muscles. Number 5. Claudication. Claudication is another early sign of high cholesterol. This refers to pain, ache, and discomfort, usually in the legs because of blood flow restriction, and is usually noticeable only during exercise. The blockage usually happens because of narrow or hardened arteries. This is caused by plaque buildup inside the arteries, usually of cholesterol. This pain, as mentioned earlier, can be primarily found in the feet, but can also target specific muscles in the thighs, calves, buttocks, and hips. It becomes worse during physical activities involving these muscles, so if you notice any of these symptoms, you might want to have it checked by a doctor. Number 4. Chest pain. Regular intake of foods high in cholesterol, as we know, can cause a dangerous accumulation of cholesterol and other deposits on the walls of your arteries. This accumulation is referred to as atherosclerosis. These deposits form plaques and can reduce blood flow through your arteries, which can cause complications in your heart that can manifest as discomfort in the chest. This discomfort can be pain, pressure, or a feeling of your chest being squeezed tightly or full and may last for a moment. It also tends to reoccur and may lead to an eventual heart attack. Number 3. Shortness of breath and fatigue. Growing older, you realize you may not be able to do some things you used to do with ease in the past, or you may not be able to do them for long durations. This is normal when you exert yourself, but should become a cause for worry when it becomes irregular, like when you perform little to no physical activity like sitting and talking with friends or climbing a few flights of stairs. This may even be the most common sign of high cholesterol that many people ignore. Ignoring symptoms like these can be critical, as they can lead to a stroke or a heart attack. Number 2. Cholesterol buildup. If there's too much cholesterol in the blood, the cholesterol and other substances may form deposits that collect on artery walls. This buildup can show up anywhere on the body with arteries close to the skin's surface, forming cholesterol buildups or deposits. Cholesterol buildups are soft, flat, yellowish lumps. They mostly appear on the upper and lower eyelids near the inner corner of the eye, and may develop around both eyes. These buildups that develop around the eye can easily be mistaken for a bump or pimple, but are identifiable in their yellowish-orange color. So, if you see yellowish-orange growths on your skin, you may have deposits of cholesterol under your skin. These painless deposits can appear in many areas other than the corners and around the eyes. They may appear as lines on your palms or the backs of your lower legs, mouth, elbows, or knees. These lesions may remain the same size or grow very slowly over time. They sometimes join together to form larger lumps. Number 1. Headaches. According to medical professionals at the University of Chieti Pescara, Italy, who were studying patients who came in for other health problems, found that frequent headaches, particularly at the back of the head mainly, were more common in older people with high cholesterol levels than those who had just the right amount or lower levels of cholesterol. Like many signs, these headaches are due to a blockage or restriction of blood vessels transporting blood to the brain. Aside from migraines, lack of proper blood flow to the brain can cause dizziness, sudden loss of balance or coordination, or total momentary inability to move, slurring words, and confusion, amongst others. We hope you know better how to spot signs of high cholesterol in your body. It is very important to look out for these signs and manage them, because the more your cholesterol increases, the closer you are to a severe health complication. So, I'll highlight a few ways you can manage a high cholesterol level. The first thing to do would be to watch what you eat. Make better health choices and avoid foods high in saturated fats, which increase unhealthy, low-density lipoprotein levels. Steer clear of trans fats, which raise this and lower protective, high-density lipoprotein. Instead, substitute for healthier unsaturated fats, which are found in fish, nuts, and vegetable oils. Whole grain breads, pasta, and cereal help prevent overeating and make you feel full longer. Many of these foods contain fiber that lowers LDL levels. Eat more fruits and vegetables, especially if you substitute these for processed foods like potato chips. And make healthy dairy substitutions, fat-free milk instead of whole milk, or low-fat yogurt instead of processed sweet ones. Finally, exercise can improve cholesterol. Increasing your physical activity daily can help raise high-density lipoprotein cholesterol, the good kind of cholesterol. You can also check out a helpful health video popping up on your screen right now for more tips, and don't forget to subscribe. Please hit the like button and click the bell icon to never miss an upload, and I'll see you in the next video.